Imagine this, you're all dressed up to go out with your friends, you look in the mirror one last time, you give your welcoming smile. But do your teeth look as good as the rest of you? Do you lose your confidence because your teeth are yellow and your gums are red and inflamed? This selfie is known as sewer mouth. Do you want to prevent sewer mouth? Poor oral hygiene can affect several things, such as cosmetic conditions like tooth decay or acne problems, or even more serious problems like respiratory problems. But that doesn't even account for the financial costs that come along with restoring these. Today I want to share what research and practice says about tooth decay and gum infections, the physical damage to your health, the enormity of the financial costs, and most importantly, how you can simply eliminate most of these problems. The first and most noticeable problem affected by poor oral hygiene is appearance. So many people take time and effort into their appearance, but they forget to manage their smile. In a study, Clinical Psychology of Oral Health, the link between teeth and emotions, researchers found that inadequate oral health, including tooth loss or throat disease or gum disease, actually limits patients from speaking, smiling, chewing, and their overall psychosocial well-being. Understanding the role neglected oral health plays can actually inspire people to take care of their teeth and gums. An article by Savannah Dental Care states that all patients have multitudes of good and bad bacteria. When you neglect to brush and floss properly, it actually allows that bad bacteria to continue to grow and multiply, causing plaque to build up on your gum line. This same bad bacteria can cause facial acne. But even though these problems seem semi-serious, they're actually minuscule compared to the bigger problems. 10 health issues caused by poor oral health by AbsoluteDental.com says that poor oral health can actually cause cardiovascular disease, respiratory infections, or even cancer. Can you believe that the bad bacteria that causes plaque can cause heart disease? It travels from the mouth into the bloodstream and then hardens plaque on the sides of the arteries until it blocks blood flow to the heart. With serious health problems and damage in your mouth, the increasing cost to restore can become an issue. Your sewer mouth has now become a money pit. An article by HuffPost.com on why a trip to the dentist costs so much states that the cost of dental work is actually increasing more than medical visits. In the dental office I work in, I had one specific patient that had to get extractions and implants with oral surgery. Because of the inadequate oral health, he had a bill that amounted over $40,000. Individually, an extraction for one tooth would be $250, and an implant for one tooth would be $4,000. Understanding the direct causes of tooth decay and gum issues might help all these astronomical dental bills. Now, let's investigate these dental problems. Even though cavities are unsightly and painful, periodontal disease is the underlying cause for most health risks and expensive dental procedures. During my interview with Jordan Smith, a dental hygienist in Baxley, I asked how a person gets periodontal disease, and she said it starts when you don't brush and floss properly and go for your subgingival cleanings. Hard calculus called tartar builds up on the gum line and actually pushes back on your bone until there's nothing for the tooth to grab onto. It becomes mobile and either falls out on its own or has to be extracted by a dentist. This disease becomes even more acute when home dental regimens aren't followed and allow the bad bacteria to grow. However, patients can save themselves from this fate by implementing simple solutions. One might think the answer to this problem is difficult, but it's actually very simple. In my interview with Ms. Smith, she stated that home care is 80% of the work in oral hygiene. Patients need to brush 2 times a day, once in the morning and once before going to bed at night. Flossing is also necessary for reaching the places that a brush can't get to, and mouthwash can help remove any unwanted debris that's left over. She also suggested getting regular semi-annual cleanings by your dental hygienist. Understanding the total oral health plan can encourage a patient to take care of their teeth. Unfortunately, most people don't worry about their teeth until it's too late. I've personally seen patients who let their periodontal disease go so far that it can only be resolved with full mouth extractions and a pair of dentures. Because of the customization of dentures and the pricey $3,200 bill, most patients go weeks without teeth, and I see their confidence fade as they leave my office. I highly encourage each of you to use these easy routines at home and visit your hygienist for your semi-annual cleanings. That way, when you look in the mirror or next time you're in the hygienist chair, you can assure that you're going to like what you see. In conclusion, I recommend you take care of and appreciate your teeth now, because I assure you without a doubt, you'll miss them if they're gone.